Hemorrhagic disorder. The hemorrhagic disorder are the group of disorder of widely differing etiology which have in common an abnormal tendency to bleed. This abnormal tendency to bleed is due to the defect in mechanism blood coagulation. There are three major components of normal blood coagulation mechanism: vascular, platelet, coagulation factor. These acts together in coordination to arrest bleeding. A breakdown in the normal coagulation mechanism results in abnormal tendency to bleeding and may result from the defect in any one of these three components. Bleeding is especially liable to occur when one or more than one component is defective. Various hemorrhagic disorder can result in uncontrolled hemorrhaging into joints, muscles, and deep tissues with the formation of hematostasis. The laboratory investigations are carried out for patients who have a history of spontaneous bleeding after trauma or surgery, or patients who have to undergo a major surgery. The hemorrhagic disorder are either inherited or acquired. Hemorrhagic disorder. These are transmitted as a sex-linked disorder and mainly observed among males, while females act as a carrier. These disorders are mainly due to deficiency of factor 8 and 9. Other inherited disorder of coagulation includes factor 11 deficiency, which is transmitted as autosomal disorder and occurs with equal frequency in male and female. Acquired hemorrhagic disorder. The common cause of acquired bleeding disorder includes thrombocytopenia due to many reasons such as infection, malignant, drug-induced immune and non-immune, deficiency of vitamin K, liver failure, therapy of heparin and coumarin group of drugs. Screening test of hemorrhagic disorder. These are non-specific tests designed to assess overall coagulation mechanism and are useful for screening of patients who may have bleeding disorder. Although these tests are simple, they lack sensitivity, and it does not necessarily mean that the patient has normal coagulation mechanism. If the results of this test are all normal, the following screening tests are recommended: bleeding time, whole blood coagulation time, clot retraction, prothrombin time, platelet count, tourniquet test, purpura. Besides this, the routine hemorrhagic disorder test includes plasma recalcification time, partial thromboplastin time, activated partial thromboplastin time, thrombin sulfate test, and fibrinogen determination are used to screen hemorrhagic disorder. Bleeding time. The duration of bleeding from a standard puncture wound of a skin is bleeding time. It is measure of function of platelet as well as integrity of blood vessel wall. Principle: a standard cut is made in the skin of patient and the length of the time required to stop the blood is noted. There are two methods of detection of the bleeding time: Duke's method and the EV method. Duke's method requires a sterile needle, filter paper, stopwatch, spirit and alcohol. Procedure: clean the earlobe or fingertip with spirit by using cotton swab. For earlobe, a glass slide is placed behind the earlobe to hold it firmly in place. This provides a firm site for incision. They puncture the earlobe deeply, about 1 millimeter, by using a sterile lancet needle. Start the stopwatch. The blood should flow freely without pressing the earlobe. Now remove the glass slide from earlobe. After pricking, the blood is allowed to drop on the filter paper. The paper should be moved so that each drop will fall on the fresh area. The bleeding of wound should be allowed without pressing. When bleeding slows, the wound is touched gently with the fresh area of filter paper at a 30 seconds interval. When blood stains disappears from the filter paper, stop the watch and note the time. Precautions: in case of children, heel should be used. In suspected cases of bleeding disorder, puncture the fingertip. The area to puncture should not be congested. The size and depth of the wound should be standard. If bleeding continues for more than 15 minutes, it should be stopped by placing dry sterilized cotton and applying little pressure on the wound. Normal value 1 to 5 minutes. EV's method. EV's method requires the sphygmomanometer cuff, which is applied on the patient's arm above the elbow. The puncture site is above the forearm. As soon as the bleeding starts, touch the filter paper and starts the stopwatch. When the blood drops on the filter paper disappears, record the time. Normal value 5 to 11 minutes. Clinical importance: the prolonged bleeding time (BT) is generally found in thrombocytopenia, platelet below 50,000 in case of von Willebrand disease. The BT is high. It is also high in case of severe liver disease, leukemia, aplastic anemia. The Bleeding time can be calculated by bleeding time is 30.5 into platelet count divided by 3850. The whole blood coagulation time, the time required for blood to clot out the blood vessel at 37 degrees centigrade, is known as the clotting time. There are two different methods to determine the clotting time: the capillary right method, vein puncture method, Lee White method. Principle: the whole blood, when removed from vascular system and exposed to foreign surfaces, will form a solid clot. In right method, the blood is collected in a capillary tube by finger puncture, and in Lee White method, the blood is collected from the vein and in a test tube. Capillary method, right method. By using a spirit disinfectant the tip of the finger of a patient and make about 1 millimeter depth cut with a sterile lancet. Start the stopwatch, wipe off the first drop of the blood and collect the blood in capillary tube up to 2 by 3/3 of its length. After every 30 seconds, break off about 1 centimeter of capillary to find out whether fibrin strings thread has formed. When fibrin string appears, stop the stopwatch and note the time. The capillary method for clotting time can be advantageous combined with bleeding time test. Vein puncture, Lee White method. Collect about 2 ml of blood in a syringe and dispense into the clean test tube. Start the stopwatch as soon as the first drop of the blood is observed. Plug the tube with cotton and keep them into the water bath at 37 degrees centigrade. After every 30 seconds, by tilting the tube, find out whether the tube is clotted. When the blood has clotted, stop the watch and note the time. Blood collected in the tube should be above 1 ml, as less blood gives shortened clotting time. The water bath temperature should be 37 degrees centigrade plus or minus 0.5 degrees centigrade. The venous puncture should be without trauma. The vigorous agitation of the tube is avoided to avoid air bubbles in the tube. Normal value for both methods is 5 to 10 minutes. Clinical importance: severe deficiency of any of coagulation factor indicates a prolongation of clotting time. The prolonged clotting time is noted in fibrinogenemia and hyperinemia. Lee White method is more reliable than right method. Therefore, right method should be used only when venous blood cannot be obtained. Clot retraction: the clot forms as end product of blood coagulation. The clot under normal condition undergoes contraction, where serum is expelled from clot and clot becomes denser. This is called clot retraction. The normal clot retraction starts within 30 seconds after the blood has clotted and is about 50% at the end of 1 hour. Requirement: clean, dry, plain glass graduated centrifuge tube, water bath at 37 degrees centigrade. The equipment for collecting the blood timer. Procedure: take 5 ml of blood by venous puncture and transfer it to the centrifuge tube. Incubate it at 37 degrees centigrade in vertical position. Record the degree of retraction after 1, 2 and 4 hours. If the contraction is not appear at the end of 1 hour, loose the clot gently from the walls of the test tube. The degree and the rate of retraction should be noted. Also note the discoloration of the serum. Measure the amount of serum expressed by the clot. Normal value: after 1 hour of blood collection, the clot should be expressed 50% of serum. Clinical importance: the clot retraction is directly related to platelet count. Therefore, it is decreased in thrombocytopenia but normal in hemophilia. It is requested in case of suspected hemorrhagic disorder. The precaution should be taken at the time of removal of clot so that the serum should not be hemolyzed. Generally, the clot is removed by using the hook-long needle. If the clot is small and serum is more, then the patient may have low hematocrit. The patients with polycythemia also have poor clot retraction. The fragile clot represents low fibrinogen value. Prothrombin time is the time required for clotting of citrate or oxalate plasma in the glass tube after addition of calcium and tissue thromboplastin. Principle: stage 1 is crossed by addition of tissue thromboplastin. The time it takes for plasma to clot after addition of thromboplastin and calcium is measured by substances in the stage 2 and stage 3. Out of these factors, the most important is prothrombin. Prothrombin time should be performed soon after blood is collected and plasma is obtained, within half an hour of blood collection. Procedure: take 4.5 ml of blood, patient's blood in a clean test tube with 0.5 ml of oxalate or citrate anticoagulant. Mix well and centrifuge at 2000 to 3000 rpm for 10 minutes. milliliters to get plasma. In other test tube, take 0.1 ml of thromboplastin suspension and 0.15 ml of calcium chloride suspension. Mix the tube. Keep both the tube at 37 degrees centigrade in water bottle. After 1 minute, the content of second tube are mixed with the 0.1 ml of plasma from the first tube. As soon as the content are added, swat the stopwatch and observe for plasma clot. If the clot is observed, stop the stopwatch and note the time. This is prothrombin time. Normal value 14 plus or minus 2 seconds. Significance: the commonest cause of prothrombin time prolongation or liver disorder, vitamin K deficiency, hemorrhagic disease of newborn. Platelet count: the determination of platelet count is requested in investigation of bleeding disorder. There are two methods by which we can get a total platelet count. These are direct method and indirect method. Direct method: in this method, the blood is diluted with a platelet diluting fluid and the cell are counted over a specified area under proper magnification. Requirement: microscope, improved newborn chamber, RBC pipette, platelet diluting fluid. Composition: the procaine hydrochloride 3 grams, sodium chloride 10 grams, distilled water 100 ml. Blood specimen: EDTA, anticoagulant blood or capillary blood can also be used. Procedure: mix the blood specimen carefully by using RBC pipette. Draw the blood up to 0.5 mark. Wipe off the excess blood from outside of the pipette. The diluting fluid is drawn out to 0.10 mark. This gives the blood dilution 1:200. Mix the content in the bulb thoroughly. After 5 to 7 minutes, discard the first drop and by using the second drop, change the chamber. After charging, keep the chamber undisturbed for 10 to 15 minutes. This will always the settling down the cell. Count the cell in the central square of a newborn chamber, that is in all 25 squares. Calculation: number of platelets per cubic millimeter is equal to number of platelets counted into dilution divided by volume of the fluid. The dilution is equal to 20. Therefore volume is equal to area into depth. Therefore number of platelets per cubic millimeter is equal to number of platelets into 2000. Indirect method: dissolve 14 grams of magnesium sulfate in distilled water and make up 100 ml. Procedure: clean the finger tip and place a drop of 14% aqueous solution of magnesium sulfate on the skin. Puncture through this drop with a little pressure and allow the blood to flow into the sulfate solution. When the portion is about 1 of the blood to 5 of magnesium sulfate, mix thoroughly and makes a thin smear. Clean the finger and makes RBC count. Stain the smear with Leishman's blood stain. Cut the small square in circular piece of paper and pat it in ocular of the microscope to reduce the size of the field. Count the number of RBC and platelet in the field. Count 1000 RBC. The number of platelet counted to 1000 RBC is multiplied by number of thousands of RBC as determined by RBC counter. Calculation: the platelet per cubic mm is equal to number of platelet into RBC divided by 1000. Normal value 1.5 to 4 lakhs per cubic millimeter. Clinical significance: increased platelet count is often associated with the polycythemia vera. The following splenectomy in the chronic myelogenous leukemia. This is called thrombocytosis. The thrombocytopenia, that is increased platelet count, is often associated with prolonged bleeding and poor clot retraction. The aplastic anemia, megaloblastic anemia, hyperspleneation, acute leukemia, and in immune thrombocytopenia. Tourniquet test. Tourniquet test is one of the bleeding disorder tests done by the physician and not by the technician. In this test, the blood pressure of the patient, both the systolic as well as diastolic, is measured. The average in calculation and the sphygmomanometer cuff is applied to the patient arm as in with the average of blood pressure. Now the hand is observed for internal capillary bleeding. This can be observed as red patches on the skin. Purpura. Purpura is a skin rash resulting from bleeding into the skin from small blood vessel, that is capillary. This results in individual purple spot on rash called Pitchie. The purpura may be either due to defect in capillary called as a non-thrombocytopenia purpura or due to a deficiency of blood platelet, that is a thrombocytic purpura. The acute idiopathic thrombocytic purpura is a disease of children in which the antibodies are produced that destroy the patient's platelet. The child is usually recovers without treatment. This Cohn-Leon-Henoch purpura is also seen in young children with unknown cases. It is associated with abnormal pain and kidney disturbance.